Hello, everyone. Good morning, good afternoon, good evening from wherever you are joining from. And you are welcome to this edition of OAU Med Talks, holding virtually across different regions of the world. And we are glad to have you join us today. Our current speaker for today is Dr. Festus Ossai, and our host is also going to join us from another region. And um, today we are having Dr. Adebayo as the host. And just as an introduction for us to start, I'd like to say that the topic of today's presentation is very interesting for doctors who are practicing both locally in Nigeria and in diaspora. And the presentation states compassionate service delivery, a panacea for good, safe, and sustainable medical practice. We would want to hear more about it. And as an introduction, I'd like to uh, talk about Dr. Festus Ossai for just a few minutes. He is a graduate of the Obafemi Awolowo University in Ife, and after his MD-CHB, he bagged the FAGP, and he is the CEO of Exploit Diagnostics and Clinical Services Limited. He is also the founder and national coordinator of the Medical Ultrasound Forum. He is he also practices ultrasonography, and he is the author of the first and second editions of Basic Principles and Techniques. He also has been a training facilitator for ultrasound scan nationally. He's the General Secretary of the Association of Nigeria Private Medical Practitioners in Rivers State of Nigeria. He's a life coach and a public analyst, and he's married with children. We would like to hear from him. As one of my colleagues has said, this is a relentless person he has known, and we would
Good evening,
like to
good
hear
people.
from him today. So we have Dr. Edgar joining us as well, and he will be taking over
Good evening, everybody.
the introduction.
How many people do we have? You out? Okay, somebody is there. Let's admit you. The OAU Med Talk series, the Edge series, just at the cutting edge of impact and change and being the best that you can be wherever you are on the face of the earth. This is brought to you courtesy of the OAU Med class of 2005. A big thank you to everyone that is making this work. I'm just here as a host today. There are some people behind the scenes that make sure that this has been on for such a long time now and been a blessing to so many people. I've been a guest on this series in time past, and today I'm here to host again. My name is Gbenga Adebayo. I run an organization called Living Health International in Lagos, Nigeria. Some people call me area doctor in some areas. If you speak some, when we go that level, we can yarn as a one yarn, but not today. We're not going to do at that level. We have a guest, a seasoned guest, that's going to do justice to a very, very, very important topic. It doesn't matter where you are on the face of the earth. Are you in Nigeria? Are you in Ghana? Are you in Netherlands? Are you in the United States of America? Or are you in Europe? What we want to discuss today is really, really important. And in a while, I'm going to introduce our speaker. Our topic for today is compassionate service delivery, a panacea for good, safe, and sustainable medical practice. Compassionate service delivery. That's very, very important. And we have a beautiful, we call him a nickname. I'm not going to call it here. Maybe when they are not recording, I will say the name. Somebody laughed in the background there. I'm going to call him by the professional title that we call him, and that's in the person of Dr. Festus Ossai, MD-CHB. Yes, that was the title. We worked out to get it from OAU, but he has not stopped there. He's also a fellow. He's the FAGP. He's the MD CEO of Exploit Diagnostics and Clinical Services Limited. He is a founder and national coordinator of the Medical Ultrasound Forum. I will talk a little bit about that later. He's the author of the first and second editions obstetric or sonography, basic principles and techniques. So he has a textbook. It's a FICO. He has a textbook that has a second edition, is a national ultrasound scan training facilitator, and of course, is the general secretary of the Association of Nigerian Private Medical Practitioners, the Rivers State branch. And of course, Dr. Ossai is a life coach and a public analyst. He is happily married with children. I remember very many years back, while very early in our career, one of the things that as a trailblazer in ultrasonography that Dr. Ossai is, he organizes training that professors, people that taught us, right? Professors that examined, people from all over the nation come and they sit under him to learn from him. Today is going to give us a blend of that compassionate service delivery. Why it's important, what it means, how can you use it, what do you use it for, how can we imbibe it in this. It's difficult to be compassionate if you have not been if you are being owed, or you want to jump out, you are not being paid as much, but it's important. It's really, really critical. It may be the difference between having your license taken away or being saved from a lawsuit. It's very, very important. Compassionate service delivery. And without further ado, it's my pleasure to welcome Dr. Festus Ossai. Chief, please, over to you, sir.
Wow, what an introduction. My head is so big now. I hope you have something I can need you to monitor it so you come down to normal size. Yes, I want to first of all thank my colleagues, my classmates for doing a very wonderful job. Some of us were not privileged to hear what people are hearing today. You know, over the time, some of us we graduated from medical school, we're just like, where do we go from here? You make mistakes, you learn, unlearn, you learn before you now finally get your path. But with what we are doing up now and this thing put in place, I think it will help to direct a lot of our younger colleagues, a lot of our students, so that they don't make the mistakes that some of us made while in practice. And of course, they will enter in a better footing. So I thank you so much. May God bless you all. Now, I want to look at compassionate service, the panacea for good, safe, and sustainable medical practice. Yes, some time ago, I was privileged to have presented this topic to the Nigerian Medical Association River State branch, talking about compassionate service, because they realized that a lot of doctors have been having crises, a lot of doctors have been assaulted, a lot of things have happened to a lot of doctors, and we tend to wonder what has changed. When we're growing up, if you see a doctor, doctors are seen in a very different light, but now things are changing. What is happening and what do we need to do? And as students, there are some things you need to prepare yourself against before you come out to the society to practice as doctors. That is why we need to take you through one of those things as well. Now, as you graduate from the medical school, you have some privileges as well as some unforeseen challenges. There are privileges and, of course, there are challenges. Now, let me go to what are the privileges you may tend to benefit from as you graduate and become a medical doctor. One, you become automatic member of the Nigerian Medical Association. For those of us practicing in Nigeria, we have an umbrella body that covers all doctors in Nigeria, whether you're in private setting or you're in government practice. And it's called the Nigerian Medical Association. It's a noble organization that helps to see to the welfare of members. Okay? But for those of us in other parts of the country, the other medical associations they belong to. So wherever you are, automatically belong to such noble organizations. Then the second privilege is that you've now become a first-class citizen. As a doctor, you're a first-class citizen. Forget about how societies tend to see doctors these days. But you become an automatic first-class citizen. You are respected wherever you go. In fact, they give you all manner of respect. Even no matter how young you are, a doctor is a doctor. And that's why as you gain this respect, there's some challenges I have to share with them as well. Then, of course, as a doctor, you have what we call an automatic employment. These are the privileges. You don't need to start looking for a job like your counterparts in other departments. It's either you are either underemployed or you're well employed. Even if you're not employed, you can have case or you be local, but something must come to your pocket every month. You will not stay and fold your hands and just wait. You cannot start as a doctor. So you have an automatic employment. These are some of the privileges. Then as a doctor, you become an automatic manager. Imagine you just graduate from your housemanship, do service, they take it to one hospital. The next thing they call you a director. Sometimes you can be a director of medical services, or they can call you medical director. So even some multinational companies, they will call you medical superintendent. So automatically you become a decision maker at that tender age, whenever you graduate. So these are the privileges you see as compared to your counterparts. In some villages, so when you go for service, maybe in the north, you realize that you are the next person to the traditional ruler, the king of that village. Just imagine a young man of 21 years being given such a respect. Well, these are the privileges you see. Then as a doctor, you have what we call classified information. There are some certain things that a woman may tell the husband, they never tell you. They will tell the doctor, they will not tell the husband, and vice versa. And that is why, as a doctor, you prepare your mind to hear things that may not be too nice to you, but you have to keep your mouth shut, keep your practice. Then you have what we call privilege of divine partnership with our Creator in the healing ministry. You know, there are two ministries. One, we talk about the physical ministry, and then we talk about the spiritual ministry. That's why when I tell some of my patients, say, good, I know you've prayed, God has answered your prayer, but still come and let us treat you so that the drug will work well, the treatment will go well. Any treatment given, any operation done, of course, it's a miracle. And you know, we doctors are privileged to know the secrets of God's creation. God is using us in his vineyard to glorify his name. So you are a privileged person to be part of that partnership. So that's one of the privileges that you tend to get. Then what about the possible challenges? The possible challenges. Now, be ready for these challenges because they will come. Be ready for these challenges, they will come. What are the possible challenges? Be ready to be the only doctor on ground to cover. Sometimes in the whole local government, maybe it's not, maybe the only doctor on ground. And you know, now you're when you start practicing, you're practicing in certain places, you can decide to shift a patient to the next step prepared. And that is as much as you can learn. When you're doing your housemanship, learn as much as you can learn. So that when you are posted to such a place, you've not go and embarrass yourself, or rather you're going to give them the best of what they can get. The other challenge is I have to read all manner of individuals, all manner of patients in the course of your practice. Then if you become a doctor, be ready to step. Sometimes you overwork yourself, you just lie down the bed. There was a time I worked someone to the extent that I burnt. The whole house got burnt. I was exhausted to be ready because I have few hands to do the job. Then be ready to not to be appreciated. Sometimes you do a good job to a patient, you treat them, do all manner of things. For them to tell you thank you, they start quarreling with you. So you have to prepare your mind against. Don't be afraid. Don't be afraid. It's still a good thing. Don't be afraid. I know some people say, is it like this? No. Just prepare your mind. You're not likely to have such an experience. Then be prepared to be financially down. People see you as a doctor as a very big man, but they don't know the challenges you are facing. Sometimes your pocket will be empty. There's nothing in your house. But they see you as a big man. So ready to be down financially. But in a country whereby people don't appreciate the health system, the government they don't appreciate. That's why you see ominous strikes going on in the country today. So be ready and prepare your mind for that. Be ready to be seen as an enemy. Are you surprised? There's a saying that the doctor is your friend today and your enemy tomorrow. Get that at the back of your mind. That man, that woman that you will start practicing, for those who are practicing right now, that is calling you sir, kneeling down before you thanking you, can take you to court tomorrow and tell the lawyer to jail you for just maybe one or two things that must have happened. So they can turn you to be an enemy tomorrow. Don't be surprised. Then of course, be ready to face the long arm of the law if some certain things are not done or put in place. Now, for those of you that will be practicing in Nigeria, we have an institution, like I said, called Nigerian Medical Association, and they have what they call the core values. One of the core values is integrity, welfare of members, compassionate service, when we're talking about professionalism and excellence, high ethical standards in practice. But our focus here is on what? Compassionate. So you can see that even the Nigerian Medical Association appreciate the fact that compassionate service is a tool that we need in our practice today. Then, what do you mean by the word compassionate? Let's just try and break it down a little bit so we can be on the same. Let's break down all together. You know, if you look at the Cambridge University Dictionary, it said, but being compassionate means the feeling or showing of sympathy, sadness for the suffering or bad luck of others and wanting to provide help. For me, you know that the word sympathy, the word sadness and suffering and bad luck is not part of our medical profession. There are other things that can come into play. So just by the wayside. Now, we can also look at it in this direction. If we want to bring it compassionate to in a healthcare framework, How do we see being completely being empathetic as they present to us and willing to provide help? It's a two-way thing. You have to get this empathy, understanding, caring, and you're concerned. And the next thing is what? You need to provide help for the best possible treatment or counsel to the patient. So if you can render this thing, put them together, you're not thinking about you're being compassionate towards your patients. Next slide. What is service delivery? You know, we're looking at compassionate service, talk about service delivery. You know, some people don't see hospital as a business. It's a business. It's a business. It's a business. It's not just a charity, it's a business because you have to make profit, you have to pay your staff salary. For those of us in private practice, you have to pay tax, a lot of things. So it's a business. And if it's a business, you also render what we call service delivery. So what is service delivery? It's a business framework that supplies services from the providers and the hospitals and doctors to the what? The clients or the patients. Some people they call patients clients these days for some certain reasons. So talk about service delivery. Now we can say to jingle all these things together, bring all of them together. Empathetic, understanding, business framework, services, caring, concern, providers. If we bring all of them together, it will take us to being compassionate service. It's what? A healthcare framework that renders services from the doctor to the patient in such a manner that guarantees empathy, understanding, caring, and concern for the patients. So that's about compassionate service, or rather service delivery. Now, please, I want us to take note of this. Very, very important. The next slide. Very important. To look at this, very, very important. Now, when you start practicing, sometimes when you treat the patient, they'll come and tell you, is it not just paracetamol you gave to me? Is it not just chloroquine you gave to me? Is it not just ordinary appendix operation you operated on me? How come you're charging this amount of money? Please, I want you to realize that doctors, and by extension, hospitals, clinics, we don't sell drugs. We don't just conduct surgeries. We what? We render what? Services. And that is why you can do maybe a cesarean section for somebody in Lekki and collect 1.5 million. You may do the same cesarean section for somebody with somebody at maybe somewhere in Kenya or something, collect like 500,000. So it depends, because you are not just operating, you're rendering what? Services. So you have that at the back of the mind in case you are being confronted on the kind of management or the cost of your services. Now the big question, the slide is not moving. Can we move the slide? Not moving? Now the big question. Hello, can we move the slide? Okay, just move, keep moving. Pass this, keep moving. Keep moving. Yes, I've just talked about this one now. Good. Now, the big question, are there any self-assessment tools that can serve as an appraisal guide for a would-be doctor or a doctor to know that he or she is actually ready to render compassionate service while practicing? The answer is what? Yes. Now, let's check the questionnaire checklist. And I want you, the next slide, please. And I want you to go to, as I'm going to think about it and tell yourself if you can be part of these services that can be rendered in a compassionate manner. The question number one, are you ready to handle cases that you seem to be competent enough to handle when you know because you want to collect money first time having a problem. Now you show you're not competent on what to do. That's when you handle a case that is not that's beyond your scope. The feeling of the patient, the way and manner some doctors address some patients, sometimes you wonder, hey, you can go and die now. What's my business? If you don't take blood transfusion, just get out of my office. No. By handling our patients that come to us. Are you prepared to show care? The next slide, please. Are you prepared to show care to your patients? Are you ready to take enough time to listen to the patient's complaints while clicking him or her before arriving at your working dialysis? I am so sorry to say this. You know, the younger doctors working for us now, some of them don't clap anymore. They'll just write complaints, examination, and diagnosis. But that's not how we are trained. But I trust our doctors from Israel. I know you are well trained to do the right job. Please, I want to beg you, at your medical school, try and clerk your patients. Because when you start practicing, it's part of what you use to make a difference as a doctor. Sometimes you see some patients want to see some doctors as against the other. It comes from some certain things they are doing correctly that others are not doing. So please learn to clerk your patients. learn to clock them. And don't say the registrar is punishing you, your teachers are punishing you. Learn to clock your patient. Very important. Now, the next one is, are you ready to make up your mind to develop a good attitude towards your patient while conducting the medical examination? I've seen a case of a doctor, they were just trying to examine the patient. So, doctor is paying. Oh, please, I don't have that time. Please, let me go and get out of this place. No, that is not how a doctor should behave. So if you're coming to the practice, please remember that you have to show what? You have to be ready to develop that good attitude towards the patient. Do you think you are prepared enough to attend to the patient's needs? Next slide. Go to the next slide. As a doctor, in no distant time, do you think you can develop a good communicating skill with your patient and also connecting with them? See, let me tell you some secrets about some doctors, not because they are better in terms of the skill. They have good communication skills. They communicate with the patient, they make them laugh, and they have self-confidence in them. It's very important as well. Are you willing to open up? Are you willing to open enough to your patient while involving them in the course of the management as you're practicing? Now, people go with a lot of disease conditions. You need to be open enough to your patient. Are you ready to do that? If you're ready to do that, then you're in for real business. Next slide. Then, are you willing to go an extra mile in the care of your patient when they need the right? There was a time, I don't know, for lack of time, I have to be a little bit faster now. When I was doing my house job somewhere in Delta State, I had a patient. I was on call that day. The woman was in labor. There was now fetal distress. We called the gynecologist. He came around. For the anesthetic nurse to handle the case, he was not around. Sorry, I had to drive my car to his place to call him. You know what he told me? Dr. Ossai, you're overzealous. Let the patient wait, Jare, let him wait. I said, sir, this baby is about to die if you don't do anything. So I had to go an extra mile because these days, some of people don't care. They don't care what happens. So for you, and if do you know what happened? After the whole thing, the woman bought me a very nice shirt and said, doctor, I thank you, because he came later and the surgery was done. Learn and try to say I can go an extra mile. As a medical student in your clinicals right now, do you think from your exposure so far, you can make an effort that is good enough in the management of your patient? Learn as much as you can. Do you show concern during your rotations how the patient's challenges are being taken care of by the doctors? For example, when they have pains, when they have bleeding, what would you show compassion for them? When you see the doctors managing the patient, how do you feel for them? How do you feel along with them? Do you communicate with them? Do you laugh with the patients at all? Are you ready to seek for a second opinion or possibly do an unbiased referral of the patient when the need arises for expertise care at the start of your practice? Some doctors will tie a patient to their practice until they die because they want to collect a lot of money. Be ready to do this and do a good practice. Are you willing to go an extra mile? Okay, no, the next slide, please. As a medical student, do you relate with your lecturers, your colleagues, roommates? Yes. Let me tell you, if you don't relate with them while you're in medical school, maybe worse off when you become doctors. You see some doctors today, they don't want to talk to anybody, they don't want to share knowledge, they don't want to do anything. Until they have problems, they'll not remember they have a family called doctors. See, doctors don't care. You see a lot of them, the way they talk to you, the way they address you as colleagues. Sometimes you see a doctor cannot even relate with their colleagues, independent of the way they talk to their colleagues, independent of patients. They bring you down, they talk down on you because they feel maybe they are much higher than you are the younger one, all manner of things. The relationship is not that healthy. So try and learn to see how you can create a healthy relationship with your colleagues, your roommates as well, even your subordinates, because never can tell when they read and write. I'm going to tell you some certain challenges that will come in as well. Are you ready to have a healthy working relationship with your colleagues, which I've just explained there as well? Are you ready to empower yourself by doing the needful that is necessary to keep you in practice? Are you ready to go for postgraduate studies? Are you ready to do some programs that will broaden your skills, make your skills better? Because the world is changing, you need to learn new things. If you don't have a good skill, you cannot render compassion. Are you really concerned about the growth and development of the work environment? Very important. Some of you don't care. Sometimes you employ a doctor to work for you. If everything is going on, that's not their business, and then at the end of the month, they come. Are you interested to know how the working environment is going on? Very, very important, because that can affect how you relate to your patients. If you have a good score in the above checklist, then welcome to the business of compassionate service in the healthcare delivery system. Next slide. What are the benefits of compassionate service? You know, we've talked about compassionate service, how to be compassionate about compassionate service. What are the benefits of compassionate service? It goes between the doctor, the patient, and of course, the community and the state or the environment where he or she is practicing. Next slide. Now, what are the benefits? To the doctors, it promotes better self-satisfaction and confidence as a doctor. Imagine after treating the patient, they are happy. They see you, they bow down to your doctor. Thank you for that day. Oh, God bless you. Doctor, you are so good. Oh, you are so hardworking. You do like this. Yes, that is time to buga. Are you getting it? Because what you see, the evidence of what you do is what the patient does. Let me tell you one thing. It is the patient that rates you as a doctor, not your colleagues. If you want to survive in practice, in private practice, it is the patient that they don't give you referrals. So that is one of the self-satisfaction becomes the key. The next one, it guarantees more respect, recognition, and honor for the doctor. And of course, it guarantees healthy working environment for the doctor. It's colleagues and subordinates. If you relate to your colleagues, you do what you ought to do, of course, this will go a long way. It can prevent or cushion the effect of medical legal challenges. You know, not long ago, a doctor was jailed, if not for the intervention of the association of that thing, they had to write an appeal. What happened? In fact, a pediatric surgeon, so that did a POP, ordinary POP for the patient. They say, well, not, no, all manner of things happened. But later we now realized that it was the way and manner he was following it up. In fact, they were so close. If we didn't show any empathy towards what happened to the child, I think there was a complication. So, and the way and manner he attended to the patient, they were not happy. They say they want to deal with this doctor. Sometimes it's not by lowering yourself to say you are sorry. Sometimes you don't lower yourself by telling the patient, don't worry, I'll take it, or smile at your patient. Show that, because mind you, there was sometimes a lot of doctors that went to jail today were not supposed to go to jail. I mean, they wanted to have problems. They refuse to say they are sorry. That's what happened. Learn to do that. Don't be too proud about it. Prevent, like talk about reduce even the effect of potential hazards. Assault on doctors. You know, there's some people that come. There was a time people come, wait, that don't, oh, now this doctor is too good. You know, if you do this kind of thing. But there's some doctors, you see them, like there was a time I was working somewhere. Some patients were saying that they will harm this doctor for town, they will beat him well. Why? It's attitude. It's attitude, no compassion. Just treat the patient the way they like. So it will help to reduce this effect of assault. And it will be a very good advert tool for the place of work of the you are good, they come to you. Even if you go to this in terms of surgeries, clinical argument, and the others. But people don't want to see them. They want to see the one that they see that happily, see them as a family. They patronize them the more. So it's a good advert tool. And of course, in the long run, it will virtually help in eliminating quackery in the health sector from declining patronage of what? Other services. If they are satisfied with your services, they will not go to the quacks. They will want to come to you at that point in time. Then for the patient, sense of satisfaction among the patient, even their caregivers. Like I said, patients are the ones that refer patients to us, not even colleagues. Oh, that doctor is good, go to him. Go to that doctor is good. So it's self-satisfaction. And it can guarantee quick recovery from the patients. You see, you are treating the patient, if they are happy with your services, they see that you see them as your own, they recover very fast. And it can lead to better compliance of treatment. They trust you. Anything you say, they take. Because they know that you see them as part of what you do, they're happy. And it can be a potential referral from the satisfied patients to the facility. Yes, it can save time of service delivery. When they trust you, anything you tell them they want to do at that point in time. But if they don't trust you, no matter what you say, they don't want to do anything at all. They say, I'd rather die than go and see that doctor. Sorry to say this, and because of time, I just need to mention it. There was a professor in one of the teaching hospitals in Benin, BBTH. The patient was telling me, I was just a young doctor there. That he's going to treat him very well. A man in a dying bed that negotiating price that patient. Is that okay? Don't know whether you're a young doctor or you're an old doctor. You know, this was so angry with that doctor. He said, you would rather die than go to see that doctor. It can happen. It can guarantee trust and confidence among our patients. You can understand. Then it can to the community. It can create a state. It can to the community, to the state and plan. It can create what? A quality health delivery system, and that will be nice for you. Now, what are the potential problems that can affect the compassionate service delivery? What are the things that could be taken against? I know it's not easy. Some who say, hey, Dr. Sai, you're just talking. Yes, I know there are challenges, but let me tell you the things that could likely be. You have what we call the internal factors and the external factor. The internal factors have to do with the doctor himself. His own personality and concentrate. Some doctors themselves, they do not have good attitude. So when they don't have good attitude to affect their practice in terms of comprehensive service, they talk about if you don't have passion for what you do, definitely it will be difficult for you to render compassionate service. You're not happy you're a doctor. You're not happy because somebody forced you to be a doctor. And there's no time, if I would have talked about, maybe in the question and answer time, I'll talk about what to call the primary, secondary, and tertiary passion in terms of medical practice. There's time I'll talk about it in the question and answer time. But the question is, if you don't have the passion for the service or what you're doing, of course, you're not render compassion. You get tired and angry if you not get the compassionate service. There's skill competency. If you're not good with your skill, you can't render compassionate service because rather be having complications, financial difficulties. This one is self-explanatory. The next slide, please. Mobility. As a doctor, for you to be able to have prompt service, compassionate service, you need to be mobile. Very important. Try to life. You want to go and save a life. You are interested to see how you can do to make somebody happy. But that's what telling you, you get to that place, I'll kill you. What do? Of course, stay in your house. Overwhelming family pressure. Some doctors come to work thinking of family pressure, thinking of this, and before they know they make mistakes. And some of them can even transfer the anger, the aggression they have from home to their patients. Then overwhelming stress at work. Illness. If the doctor is ill, you cannot render compassionate service. Distractions, judgment, fear of the unknown. What are the external factors? Uncooperative colleagues and overbossy or difficult superiors. Some colleagues are very uncooperative. They don't want to work with you, they want to frustrate you. Sometimes you have your superiors, they call you all of names, you are dull, you are stupid. That is why when you train abroad, I must commend those of them in Western countries, the way they do their residency program, they encourage you to grow. But here in Nigeria, so if you meet some certain senior colleagues, some certain chiefs, so you are done for it. You call yourself names, which will not be good rather than encouraging you. So those things can happen. Difficult patients, there's some patients, no matter what you do for them, they're difficult, they won't agree with you. It can be a limiting factor for compassionate service. Then third-party syndrome. I must hear from my pastor before I collect my drugs. I must hear from my uncle before you take me to the theater. And they're dying. So, and whatever these third-party people tell them to do, that's what they do, no matter what the doctor says. That can be a problem as well. There are patients not willing to pay bills. Some patients will just come and demand for everything. When you come to pay, the doctor don't have money. As if you're running a charity home. And it's a very, very, very big problem, of course, in this part of the world. Not willing to pay these litigations. And we have to call rebellious subordinates. You have people that are working on it, they are fighting you unnecessarily. Although this one is common in the teaching hospitals and government hospitals where nurses and doctors are having issues. But in private practice, you fight me, attack you. And of course, I employ the next person. What are the other conditions? Poor condition of service, poor emergency service delivery, insecurity, inaccessible credit facility. Yes. You want to render good service, you want to upgrade the services, and you need a credit facility. It's not available. What do? It becomes a problem to render compassionate service. The poor referral system, poor social amenities, disease spread, you will believe me. COVID-19, a lot of doctors had to control how to see their patient. Before you come to your patient, you smile at them, you get close to them. But during COVID, what do? You give them a safe distance. And patients, they see you as like a father, a friend, a brother. But the moment we start seeing your patient from a distance, that relationship tends to be strange. So don't blame us. A lot of us were lost during the period of COVID-19 pandemic. Religious bias. Some of them don't take blood transfusion. Some of them don't do this. In as much as you know that this is what you intend to do. Because the most important of compassionate service is to make sure you solve the patient's problem. So how do you solve the problem if the patient is not cooperating? Maybe based on their religious beliefs. Ethnicity, social class can be a factor. Sorry. Okay. In conclusion, as a potential medical doctor, and as doctors right now, you will now agree with me that no matter what, in order to guarantee a safe and a possible sustainable practice, compassionate service delivery is a needed, inevitable tool in our society. Thank you very much.
Wow, that was a succinct, packed, professorial presentation. At a stage, it looked like Dr. Festus was presenting an inaugural. So thank you so much for sharing of the depth of your experience, that very interesting topic. I hope people have questions. If you have questions, all you need to do is to just lift up your hands, or you can drop it in the chat box while I just start to prep and ask Dr. Festus some personal things. I know it's your own journey. For instance, you say compassionate care. You mentioned internal factors that prevent us doing that. And then you also mentioned external factors. The internal factors have to do, of course, with the person, and then the external. Part of the things that in this age and time now where we are doing the work. Can you hear me, sir?
Yeah, it's breaking. It's breaking.
Yeah, your connection is breaking. I don't know whether it's my connection or your connection, but one connection is breaking.
The network is bad. I can see that
it's paging. Can you hear me?
I can hear you now. Before it was just breaking.
Oh, great. So I was saying that if we are going to take a look in what advice you think give to colleagues, what advice you give to colleagues that are struggling? People are leaving, they are running away. People that choose to remain in this, and people that are leaving their work, the people that have left and remain, their work has not reduced. So what advice? How can they navigate this problem? They are being overworked, and then of course, when you have to see 50 patients, how do you maintain a sense that this patient has not seen you before? So the problem of the other 99 patients that you have seen, that you should not take it out on this particular patient. What are the things that I know you are, and that may be important for you as a sonographer? You see a lot of patients regularly. You do training for so many people. What are the advices that what advice you have for people to cope when they're overworked and they still need to remain compassionate?
Well, I would say it's a very difficult decision to remain in Nigeria. I must honestly tell you that. In a country whereby you provide everything for yourself, from the electricity, security, from so many things yourself. But so it takes a lot to stay in Nigeria. I think this thing affects more on those of our colleagues in the government setting that depends on salary from the government. You're in a situation where you're working for years, there's no promotion, the money is not coming. So if you have a better opportunity, move. And some of us too in private practice too, when you look at it, that thing is not really moving the way you ought to do, then of course, you may want to see the other way. However, in our practice today, there are some certain things you can do to survive in Nigeria. You want to survive, especially in private practice. One is integrity, and two is consistency in what you do. Like when I started practicing, at the same time I wanted to close shop and run away. Because you come here, you sit down, before you know, you have to pay salary, become a problem. But I now realize that over time, the people now have self-confidence in what I do, because I do both clinical practice and also do both ultrasound. So people come and they now trust what I do. And people refer people from other parts and they tell me, go and see Dr. Ossai, go and see Dr. It's not because there's one particular thing I do, but because of the way I handle my patients. So consistency, okay? And consistency and being true, integrity are two important things. And also, as doctors, we should try and have alternative source of revenue. If you think that this thing we are doing here will give us all what we want, that will not really be good. Some of our colleagues today, they have fish farms, some are doing to agriculture alongside their practice. So this way you can see that they will have different sources of income coming up as well. Like me now, there's other things I think I do too that still augment my practice. But if I want to depend only on my practice here, by now maybe my jaw will be inside and my tongue will be inside, okay? But just by the reason. But what I'm trying to say is that for you to survive, think of other things to do to sustain your practice. Then now, if you are highly stressed, like I tell you, don't kill yourself in practice. Because I didn't have time to talk about the physician pledge. One of the things about the physician pledge that you as a doctor, you must what? Take care of yourself. That will talk about the last part of the physician pledge. Say, I will not talk about, I will attend to my own health. If you are working and you are exhausted, take a break. Some of us believe that if you don't take a break, if you take a break for once, you lose all the patience and trust. No way, nobody will kill you. Take a break so you don't break down. Do as much as you can and leave the rest to God. The patients will always see doctors. You are not the only doctor on ground. Are you getting it? So that's it. So for you, if you want to travel, first of all, ask yourself, what's your vision? Maybe what is your vision? Some of us have vision of what we intend to do in the next 3, 4, 5 years. Someone say, okay, I don't think my vision can be achieved in Nigeria. I have to move on. So if your vision, what you have, cannot be achieved in Nigeria, the best thing to do, my guy, is to just go to a place that will value your services and pay for your services as well.
All right, great. Dr. Festus says, be compassionate with yourself. So we should show, as we are showing compassion to other people, we should also show compassion So that we don't break down. If you are there, you are not used to anybody. So as this work passes of years, let's try to give our best to each individual patient. We never can tell how it may pay off. That person you see today, like Dr. Festus has said to us, maybe they want to refer you and get you to a bigger promotion. That may not be, it may not be money for you in the public service. It may be that that person may be the person that will recommend you and you become a minister of health and solve all the problems in our health space. There's a question in the comment section that I'd like you to please see if you can answer for us. It says, is there any room for mandatory feedback from patients about a doctor's practice in Nigeria? Is there anything like that? I'm not aware of anything like that, especially in the public sector. Unless the private sector,
Yes.
feedback.
I think, the greatest feedback you can hear from patients in Nigeria are the referrals you get. And two,
okay, but sorry, I cut you short. Is before you answer what you were saying, but are you aware, because you are in the AGPMP, of any mandatory, or is that in the works? Because I'm sure there's nothing like that now. Is there a mandatory feedback system for patients? Do you think something that we should work on, and then you can start to say the other things that you want to say?
I think that one, for now, I don't think there's anyone I'm aware of. There's no system in Nigeria that creates a mandatory feedback from patients. So what you normally do, like in private practice, the patient will always come back. Some of them don't even come for follow-up because the feedback system has to do with not only the doctor and the system, but with the patient. Some of them, if you are monitoring them for 1 or 2 things, they don't come back until about 2 years. And they come and tell you, that thing you did for me that time, after you treated me for 3 months, I was feeling ill. And I traveled somewhere after 2 years. So it's a problem, not only the system, but we doctors and also the patients themselves. I think it's a big challenge that we look into.
How can we now get feedback? Is it important for we to try to get feedback? Those are the things that you wanted to mention.
Now, let me tell you one secret. Being in clinical practice and being in ultrasound as well has given me a lot of edges in what I do in scan, because you could conduct a scan now. The next time you take the patient to the theater, you confirm whatever you're seeing. So that is another feedback mechanism. Now, the issue is that in private practice, you may be lucky to see some of them that will come back and follow up. Some of the major challenge is this: once the patient is well, she sees that there's no need to go back to the hospital because it is believed that only sick people go to the hospital. Now I'm not sick again. What am I going to see the doctor for? So that has been a very big challenge on how to get our feed. But I think we can develop that if we can have a what we call a human resources department that will follow up patients. Like some of our colleagues do that. Sometimes we do that too. After treating the patient, we call them. How are you today? How's the drug working? How are you feeling today? Then whatever they tell you, you put them down and write it by your own efforts. If not, that will not work.
They're fantastic. I just want to ask you, well, to my knowledge, I know some of us have written books. Some colleagues have written a book. I know a few other people have written books. But you are the only one I know from our set that has written a textbook, and not just one edition. You've written 2, edition 1, edition 2. So can you please tell us how do we go about that? If I want to write a textbook on, I don't even know what I want to write a textbook on now. So how did you go about it, and what are the tips, tricks? Because that might be another way for Goro to jump now. So may you tell us.
Yeah, I think in the year 2012, let me tell you a story. I went to the radio diagnostic department in Lutz. So there was this company that wanted to come and launch their ultrasound machine in Lutz. So they invited me as one of the speakers, 2012. So while I was there, so this guy came up, Nigeria, there's a way you communicate in Nigeria. If you come there and don't communicate the way people understand, they'll think you're not talking. So the guy was not communicating well. So I just came up and said, let me take over from him. As I started talking, people started writing. And I asked myself, what am I even talking about that they're writing? So they were now asking me, hey, please, when can we get your book? That was when I got this inspiration. I said, the book is on its way. Mind you, I've never thought of writing a book at all. So I said, okay, this is a good one. Maybe I should start gathering my materials. It took me over 5 years to gather materials. Start gathering my materials for my personal work and of course, what really gave me more inspiration is my training, because anytime I train, I learn more, I research more, and I learn more, and learn of this. So what I did was, it's like I put my experience in what I do to writing the book. Of course, it was not easy. There was a day I cried to my God. I said, God, I'm tired. Because it's an inspiration. God gave me the inspiration, honestly speaking. Because there was a day I just took the book. I said, because it was occupying my time. My wife was tired of me. Every time I'm writing, I don't sleep at night. I'm writing a book, researching and the rest. I know writing a book is different, but writing a medical book to your colleagues, your senior colleagues, even the one that know more than you, is another ball game entirely. So one day I got frustrated. I said, God, I'm tired of writing this book. I'll throw it away. One of the doctors I was training now looked at me and said, Dr. Ossai, God has given you a skill, and he will ask you one day what you did with this skill. As he told me that thing, I got afraid. I said, hey, that's true. Because it's like a skill that is divine, honestly speaking. Sometimes when I do things, I just get the divine revelation, and I get the results. So that got me afraid, and I gathered the material again. I started writing again till I now produced the book. It was not easy. Because of it, I tend not to do a lot of things because of the book. There was a time I wanted to go into, I was preparing for going to residency one time. As I wanted to, the book came, I just dropped everything. So let me finish this book. It took me quite a lot. I've taken a lot from me. Before I come, and the book has helped you a lot. It helped a lot. I would like you to have a copy anyway. Okay.
Fantastic.
So like when I went to, as soon as the inspiration I got.
All of you have everybody has said all over the world, though, that I'm going to get a copy of Dr. Ossai's, the second edition. Somebody has asked a question in the comment section. He said, as someone privileged to have seen Dr. Ossai as a student and now as one who runs his own practice. Two questions. How did you get into ultrasonography as an extension of your practice? So that assumes that ultrasonography is an extension of a practice. So you can help us clarify that if ultrasonography is all you do, or you also have a practice and then you now do ultrasonography, and how do you manage your ultrasonography with your clinical practice? So, and then of course, Dr. Sheike says is really, really proud of you, as we all are proud of you. So is ultrasonography all you do, or is it part of a practice? How do you combine and mix all that together? Dr. Ossai, sir.
Yeah,
over to you, sir.
Let me start from here. My being into ultrasound is divine. I was working in a hospital in Delta State, one of the biggest ones in Delta State, as a medical officer. I was working. So I got tired of the job. I started looking for jobs, buying newspapers, all these Thursday Guardian, they only advertise jobs. So I now saw a hospital that had different branches. I said, for a hospital to have different branches, it must be a big hospital. I said, no problem, let me apply for a job there. And I applied for a job at the hospital. So I know it was a diagnostic center, had different branches. I never knew what they were doing. I just needed to leave Delta State. That was what landed me in Lagos. When I got to Lagos, are you familiar with Tojo Scan Center? Now called Union Diagnostics and Clinical Services Limited. Are you familiar with the name? If you go to Lagos, it's very popular. They have a broad brand in the country. So I applied. And when they saw me during the interview, I got there. I said, oh, I thought this was the hospital I'm coming to now. But I said, I'm already here. Let me just go along with it. So when I got there, so that was how we now started. I started learning the job, and I developed the passion for the job. In fact, when I was with them, there were about 20 doctors working for them. But when I left them, I was about 3. Because I showed a lot of, and I now saw the gap between the deficiency in ultrasound knowledge in Nigeria. And I said, well, this is an area that we need to invest in and to see how people can be empowered in this. And a lot of people do a lot of things. So that's where I had my experience, started going for a lot of trainings and that, and I developed my skill until I now left them and now have to work somewhere and start on my own. Now, what I do now is this. I run a private practice. I run a full hospital because I still love clinical practice. Honestly, I love clinical practice. I don't. And it is what is even helping me out in my ultrasound. Because if I am solely in ultrasound scan, I will lose my clinical practice. Are you getting it? Because for you to be a good sonologist, you must have some level of good ultrasound clinical acumen for you to make something like that. So I practice, I do surgeries, I see cases, then I do a lot of things here. Although when there are major surgeries, I invite surgeons to come and do the rest. So I run a full practice. It's not easy. Like currently, as I'm talking to you now, I'm doing a training program from someone that came all the way from Nasarawa State down to River State. It's not easy. Sometimes I feel like collapsing, but very soon, like I was telling my wife the other day, I think I paid my dues. I need to relax.
we never fire you. So please be compassionate with yourself.
No, Nigeria, we need to get the money, but of course, I've started piping down so I don't collapse one day. All right, thank you very much. Now, this is the book. This is the book.
Oh, look at
this.
There's stuff there. The thing is stuffy. It's looking so stuffy. And it looks like a good book. Solid print. Awesome. Fantastic. Great. So here we are, Dr. Ossai Festus manages his own practice, runs ultrasonography training all over the nation. He goes north, south, east, west, and then of course. Okay, I think it's breaking there. We have some connection problem. And it's a fantastic thing. Dr. Ossai, thank you so much. It's 9 p.m. Thank you so much for your time. I would just like to give you 2 minutes. Final words. What final words we have? We shared a lot. You told us, I hope people that watch this will pick some of the things from what you have said. Time and chance. You just ran into destiny, but you applied yourself. God was helping you, and hard work. What you have said to me, a lot of hard work, stretching yourself. Really, really, really important. So final words, 2 minutes. Just give us a final charge for friends, for colleagues, for the young ones that will watch this.
Yeah, I must say that I was just privileged to run into what I'm doing today. If I was well informed much earlier, like maybe I'm picking it somewhat earlier. So it's a privilege I'm doing what I'm doing today. What I want to say to our colleagues and even is that the medical may be difficult for a lot of us, whether you are here also in Nigeria, because a lot of we have our expectations. But we are a chosen generation. If I want to use the word of a royal priesthood, we are a privileged people that God has ordained to see the secrets of his creation. And God will certainly bless us if we do the right thing. Let's all be honest, put level of integrity, and of course, let's be open to whatever we do. Don't go beyond your practice. Do your practice and do it very well, and you'll get to the top at the end of the day. Thank you very much.
Thank you, Dr. Ossai Festus, for that beautiful presentation. And I must thank you as a public speaker as well for keeping to time, keeping things succinct, keeping them short, but yet very impactful. So, friends, you've heard it all. It's important that we follow opportunities, follow through, stretch ourselves, do our best, and the sky is the limit. Let's be compassionate. It pays in the short run and in the long run. You may not even know how it will pay you, but stay compassionate. Okay, so this is area doctor now. They sign out and then they hand over.
Doctor.